It's going to be pretty busy because the test is on Sunday. So hopefully we'll get quite a few viewers.
I think we will.
And I'll get my book out because I'm going to be taking notes and writing down all the fabulous questions. And Brad will be answering all the fabulous questions. Okay, that's started. So that's good news. And let me go back and we're about to get started. Whoops, I've got the wrong screen up, haven't I?
Wrong screen there. So.
There we go, that's the one. Cool, okay. I think this is it. Let me do the little intro and then we'll get started.
Go for it.
Hello, everybody. My name is Jay. I'm one of the expert OET teachers here at E2 Language. And this here is Brad, also one of the expert teachers here at E2 Language.
Hello, hello.
In this live class lesson, whatever you want to call it, actually, it's an Ask Me Anything. And what we're going to do to start with is we're going to focus on OET speaking. So we're going to do it in sections. So rather than you just ask us questions about anything, we'll do speaking first and then writing, and then we're going to do reading and listening together after that. So please, if you're in the Zoom live class here, into the chat, please ask your questions about speaking, or if you're on YouTube Live, pop them in. I'm going to be monitoring the YouTube Live chat here. I'm going to be noting down all the questions and handballing them across to Brad, so it's a little bit more organized, and we'll see how we go. So go for your lives. Let me manage this chat here. Okay. Can you see Tanjil's question there, Brad?
I can indeed. Can you see it? Are you?
Yep, I can see it.
Yep, I can see that.
Get into YouTube and do this. So if you want to start with that one, and then I'll start writing down other ones.
So improving your speaking overall. Look, it depends, Tanjil. Look, the way that I usually answer these types of questions, in all honesty, is I ask how often you are actually speaking English, how often you're actually using your English on a day-to-day basis. You've mentioned there in the chat that it's down to confidence, and confidence is the key, I'm telling you now, for speaking. Look, the speaking test itself, obviously grammar does come into it. It is not entirely based on grammar, okay? So it's a lot of the time students focus so much on grammar that they forget all the other aspects of speaking, and it obviously involves a lot. So the more confident you can possibly be on exam day, the better you're going to go. Look, the practicing, it's good to have a bit of feedback as well. Excuse me, if you're practicing with another native English speaker would be perfect. Recording yourself is always a good way to go as well. If you can record yourself and listen back. Even just doing some shadowing techniques where you're actually just copying exactly what was said, say, for example, during a BBC recording or an ABC health report, something like that. TED Talks, something like that, and actually copying that tone, that intonation, anything that you can do just to improve and to boost your confidence for exam day would be perfect. Is there anything you want to add there, Jay?
Confidence-wise, I mean, there's all these different elements, isn't there? There's the vocabulary element, and the immediacy of vocabulary is often the problem with speaking confidence. How quickly does that word come to your mind? How immediately does it come to your mind? And then you've got the grammatical issues as well. But as Brad said, in OET speaking, the emphasis certainly isn't on grammar. It needs to be clear what you're saying. And then you've got the pronunciation stuff. So you've got the sounds that you're making, and hopefully you're getting all 44 of the English sounds correct or close enough. But then you've got other elements with speaking, haven't you? Like intonation and pausing and sentence stress. And so there's a lot that goes into speaking. And yeah, I think it's a coordinated effort to get all of those skills together. Okay, here's a good question from Kyo Win Tuan. Kyo asks, do we need to finish all of the tasks? So you get a role play card in OET speaking. And on the role play card, you get a little scenario and you get a number of tasks that you have to do. And Kyo's question is, do I need to complete all of those tasks in the 5 minutes? What's the answer to that one, Brad?
The answer to that is a big no. You don't need to. Look, basically, the way that the speaking role plays are designed, there are enough tasks on there to get you to go to around about 5 minutes. More often than not, you won't actually finish it, and that is not going to affect your score, provided that you've given the gist of what the entire role play is about. So, if you've missed 2 or 3 tasks, obviously I don't think you would have actually spoken enough to complete it. If you've just missed 1 task, it's really not going to affect your score at all whatsoever. I'm just trying to read your comment there as well. Look, try to think in terms of the most important tasks for that particular role play. So, for example, if you're, showing empathy or trying to persuade the patient, something like that, if the last task says something like, offer a brochure to the patient or something, obviously that's not a high priority. Okay, so even if the interlocutor says, okay, that's 5 minutes, stop, you're not going to lose any points. So you don't have to have a closer or anything like that. So please don't worry about that one.
Great, cool. Okay, Vinaya's got a question from YouTube Live. And remember, we're just asking questions about the speaking now. We'll move to the writing and reading and listening next. So Vinaya asks, how do we know when the 5 minutes is up?
So the interlocutor will actually tell you when that 5 minutes is up. There's no clock and you can't see a timer or anything like that. But that interlocutor will tell you verbally and probably just do this or something like that, just to know that it's definitely stopped. Okay.
Right. Excellent. Excellent.
So you just keep speaking. Just try to keep interacting with that interlocutor, with that patient, until they actually say stop.
Okay. So Des and Adaremi both have a question about the criteria, and it's a pretty broad question about what is in the OET speaking criteria, or put another way, how do the assessors actually grade your speaking?
Look, we've got the linguistic criteria, which really hasn't changed at all. The new communication criteria, look, I mean, without going into too much detail, because it will take quite a while, we do cover those in our speaking classes as well. So please join us for the speaking classes on Wednesday. Basically, it's testing your ability on your actual communication overall. So you're thinking about things, how you actually relate to the patient, how you're giving information to that patient, how you're gathering information from that patient. So all of those types of things come into it now. It's not weighed as heavily as the linguistic criteria. It's only out of 15, and each criterion is worth 3 marks. So it's not actually as heavily, it's not as, it is important, I shouldn't say it's not as important, but it's just not as heavily weighed as the linguistic. But it is still very, very important. Yeah, it's all over the OET website. I think it's also on our website. It's on our blog for sure. So yeah, if you want to look more into it, please look into that before the actual test. You need to know what you're actually being tested on. Okay, it's very, very important. Anything you want to add to that, Jay?
No, but Asama's got a good question here. Asama's asking about, in the speaking, it's a speaking test, but you have to balance a lot of speaking and listening as well, because correct me if I'm wrong, a lot of your speaking score in this test is actually based on your ability to listen attentively and carefully. What do they call it? Active listening skills. Is that correct?
Yes, that's right. And I mean, look, active listening skills, I very rarely call it a speaking test. It's more of a communication test. It's not like other English tests where you're just speaking alone. It's an actual, your communication with that patient. So it's a back and forth kind of a thing. Look, if you don't listen attentively to the patient, you're not going to understand what they actually want. You're not going to be able to respond. So part of that now is in the criteria, and it's the way in which you actually respond to that patient. So yes, listening is as important as speaking in this test, without a doubt.
Excellent. It's a good question, Asama, because one of the issues that a lot of candidates have is they don't listen to the patient, and they speak over the top of the patient, or they don't respond appropriately to the patient. And that's a big no-no. You need to make sure that, yeah, you're paying carefully. And another good thing I think about why it's good to listen carefully in the speaking is because it'll actually make you less nervous. So when you're focusing on yourself so much, your anxiety can sort of grow. But if you're actually sort of shifting outside of yourself to focus on somebody else and paying attention to what they're saying, you actually find yourself to be a bit more confident. I think it's a good strategy for reducing anxiety as well. Okay. Niga has asked quite a practical question, which is, how do we start the conversation with the patient?
Look, that's a good question, and it really depends on where that consultation is actually taking place. It could be a hospital ward, it could be an emergency room, it could be a GP clinic. It also depends on whether or not you know the patient or not. So you might have prior knowledge of that patient. A lot of the times you won't. So you can start it off very, very simply. But it all basically comes back towards the setting. So say, for example, if it's a home setting, so you're going to that patient's home, try to keep it as natural as you would with a real patient. Try to think in terms of how you would generally talk with that patient in real life. So if I said, hi, I'm Brad, I've come to your home today to talk with you about diabetes. Hi, I'm Brad, I'm one of the community nurses. I've come to your home to talk to you about insulin injections. Something like that, very, very basic. If it's on the ward and you do know that patient, say, for example, you've been looking after that patient for a week, you don't need to go up and then say, hi, I'm Brad, I'm the ward nurse here. You already know that patient. So you can go straight up and just say, hi, Bob, how are you feeling today? Something very, very simple just to get the ball rolling, so to speak.
Excellent. Excellent. Great. So here's a question from Kjorwin Tun again. So if we misunderstand the speaking note, actually in this, Kjor's worried about misinterpreting the information in the task. And this also relates to Jaskarat's question as well about, do we need to know medical knowledge, for example? And what if we say something that's incorrect about diabetes or something? Is that problematic?
Yeah, look, I mean, you're not tested in any way, shape or form on anything medical, okay? The biggest thing that I want to try to get through to everyone is the fact that the assessors are not medically trained. The assessors are not doctors. They're not nurses. They are English professionals. So they're only going to test you on your English. Now, if you misunderstand one of the tasks and you go in the wrong direction and you're providing not necessarily the wrong information, but you're going about it a different way, you're not going to be scored any down whatsoever. You are only tested on your English ability. So if you are still communicating very effectively with that patient, there's no problem at all. If you misunderstand a medical term, for example, no problem at all. But it is also very, very important in that first 3 minutes that you have of actually reading through those, through the task, through your role play. If there's any vocabulary, if it's medical or if it's just general English vocabulary, if it's something you don't understand, ask the interlocutor before you start and they will explain it to you, okay? But no, you won't lose any points if you go in the wrong direction. You don't have to worry, providing the fact that you're actually still communicating very, very effectively in English.
Excellent. Okay, a couple of just preparation questions here, which are good ones. So Tanjils asks, how do we take a one-on-one tutorial, or can we take a one-on-one tutorial on E2 language just on speaking? And the answer is yes, you can, which has been incredibly helpful because you actually get to sit there and do some mock role plays with one of our expert teachers who will then provide you with all the feedback you need to sort of correct mistakes that you're making, linguistic mistakes, test mistakes, clinical communication mistakes. So it's a really rapid way to improve. And it's an incredibly good idea if you're taking the OET soon, for example, just to make sure you're doing it right and to clear all of those doubts you have. Also, you might want to check out our mini mock test as well. So we've got this mini mock test for sale on E2 language. It's a computer-based OET mock test. And as part of that mock test, you get full exam simulation for listening, reading, writing. And for speaking, you actually take a one-on-one on Zoom like this. And again, you do a mock role play, and then the teacher will provide you with lots of comprehensive feedback. So yeah, it's a great way to prepare. Okay, we're going to move across now to writing. So I'm sorry if I missed some of your questions, but we've got about 110 people watching, so my apologies. Okay. Writing is, actually statistically, it's the most challenging task. If you look at all of the data on the OET website, they show which part of the test is the most challenging, and it's writing. Most people do pretty well in the reading, listening, and speaking sections, but this is the one where lots of people fall down. Just briefly, if you haven't taken the OET test before, it will be profession specific. You'll get a set of case notes. So nurses get case notes for nurses, doctors get them for doctors, for example. You have time to interpret and read the case notes where you can't write, and then you have to begin to write usually a referral letter. It could be a discharge letter or a transfer letter into a nicely formatted letter, which focuses on the most important information from the case notes, puts it all in there logically. There will usually be some sort of request, etc. So that's just a basic outline of the writing tests. Okay, so Abdul says, there is always confusion about the referring sentence. Do we have to explain in short about the patient's disease or inference for referral?
Look, for a referral, there is always this confusion. You're right, Abdul. I would openly admit there is a lot of confusion for this. Basically, what the OET is saying now is that you should state the purpose of the letter up front. So you're showing that immediately, and then you're expanding on that throughout. That doesn't just mean writing the word referral. So that might not just be the purpose of the letter. If the writing task, say, for example, says you're referring a letter to such and such for further investigation or for further tests and investigation, something like that, that is the actual purpose. And so all you're actually saying in that opening sentence is just sort of introducing the patient, giving a very brief introductory sentence on the actual purpose of that letter. So you don't need to go into any detail, really, any great detail. If you want to mention the patient's current condition or what they're actually being referred for, and the reason for that referral in a nice quick sentence, that's all you need to do. I hope that answered your question.
Yeah, it's a complicated part. That initial sentence or that initial paragraph has caused a lot of confusion. I think it's because of the new changes to the writing criteria. Do you want to just comment briefly, Brad, on what those changes are?
Look, the biggest change to the writing criteria, honest to God, for students is just making that purpose immediate and apparent. The other changes are more for the assessors. People are really, really worried about the change in criteria, but it's more about how it's actually being assessed back at OET. It's not really making any difference to the student themselves. So look, as long as I said, as long as that the purpose of the letter is immediate and apparent, so in other words, if they're being referred for further treatment and investigation, that's what you would write. You can use those same words. People are worried about having to, use synonyms for those words. You don't have to sit there and rack your brain for 35 minutes trying to think of a synonym for it. You do not have to do that. All your job is to state what the purpose of the letter is and then to expand that throughout the letter. Okay, so you're providing more information throughout the letter. That's all it is.
Great. Okay, Nurit asked a question about medical abbreviations. I can't remember specifically what her question was, but can you just talk briefly about the use of abbreviations?
Yeah, look, abbreviations always confuses people as well, I must admit. So I was just reading one from Tien there. Look, abbreviations, I would only really recommend using what is in the case notes themselves. So in those case notes, if they have used a medical abbreviation, you are very, very welcome to use it. The problem is that I'm going to have to say mostly doctors will use a large section of their test will be abbreviations because that's how they generally write. Now, in real life, that's fine. In OET terms, you want to try to avoid that a bit. Commonly found abbreviations, no problem at all. So say BP for blood pressure. Everyone knows what that is. You're very, very welcome to include it. Anything that's a little bit more, questionable or unidentifiable, definitely write out the full word. But look, things like, I've seen people write out, the full thing for HIV or AIDS or something like that. There's definitely no need for that. Acronyms and things like that you can use, but just try to use what is actually in the case notes. Okay, and try not to overuse abbreviations. That's all that is.
Great. Okay, Sadi has got a question, which is, A classic question, which is, should I include X, or should I include Y, or should I not include X? And the answer to that one is it entirely depends on the task and who you're writing to. So should you include this information? Who are you writing to? Why you're writing to them? What's the purpose of the letter? Does that recipient of the letter already know the patient? In which case, maybe you don't include X, for example. X could refer to a medical history or the social history or something like that. So the answers to these sorts of questions about basically what's a good template for a letter is there is no good template for a letter. You need to be flexible on test day. You need to put yourself in the shoes of the recipient and think, okay, if I were the physiotherapist, what would I want to know according to these case notes and according to this task? So please try to resist using sort of templated structures like that. We certainly have been told by OET themselves on a number of occasions that if the assessor looks at your writing and sees that you've just used some sort of formulaic template, then you won't receive, you might still pass, who knows, but you'll certainly receive a better mark, or you'll increase your chances of success if you write flexibly and on test day according to the task and case notes. I hope that's clear. That's a question we get all the time, isn't it? But fair enough too. Fair enough. All right. So Nurit's got another question about summarizing information. What's the best way to summarize info?
The best way to summarize information? Well, look, make sure it's relevant information, firstly. As Jared was just saying then, it's best to actually focus on just what is relevant and what is not relevant, leave out. There's no right or wrong way of summarizing information at all. You would like to try to connect those relevant details that actually connect up as well. So a lot of the time people do just focus on simple sentences. And I do like to point out the fact that you can use simple sentences. There's no problem with that. One or two, no problem at all. It makes things stand out and really, very obvious to the reader. But the more you can connect information that is connectable, the better you're going to go. So look, when you're summarizing information, you don't have to think in terms of every word needs to be changed either. And people do stress about that. They think I can't use the exact words from the case notes. I have to change them. I have to paraphrase them. I have to use synonyms. It is a good idea to try to do that as much as you possibly can. But it is absolutely inevitable. You will be using some of the language directly from those case notes. And there's no problem with that whatsoever. Sorry, Jay, did you?
My suggestion for summarizing is what you can do is you can combine case notes into a single sentence. Sometimes in the case notes, they'll repeat something several times, and you have to ask yourself, okay, do I then in my letter need to write that in separate sections, or can I take this case note, and this case note and synthesize it into a sentence or even a phrase? It's definitely a skill that you need to practice.
Some of them are easier than others, though. I mean, if you look at an example such as, say if the patient required daily dressings during their stay in hospital, they require daily dressings after discharge. Something like that is a very, very simple thing just to connect together in one sentence.
Yeah. Great. Okay. Tien's asking a number of questions about sort of small grammatical things like using before fever, or should we use direct or indirect speech sort of thing. What's your suggestion about the importance of grammar in this letter?
In all honesty, I mean, obviously grammar is important, okay? The main focus and one of the actual changes to the criteria, I should actually point that out. I should have pointed it out before. There's less emphasis on being grammatically perfect. So long as the information is actually easily read from that person reading the letter, the information is easily absorbed and it's very, very obvious. It's, what's the word? Jay, help me out. What's the word there that I'm looking for?
Sorry, I was reading something.
You
Say
were
it
reading
again.
something. You weren't listening to me. That's okay. This is all part of your test. Basically, look, the reader needs to be able to understand exactly what you mean, but your grammar does not have to be perfect.
Yeah.
Now, for something like fever, if you just write the patient had fever, the patient had fever, the assessors are not going to care. The general rule for that basically is if it's something very small and transient and very acute, they usually use So you have a cough, a fever, a flu, something like that. If it's long term, if it's chronic, you won't use the article before it. So the patient has diabetes, the patient has asthma. Very, very easy way to remember it. It's not always accurate. There are some exceptions, as there are with everything. But basically, anything short term, put or an in front of. Anything long term, don't. It's a very simple way to remember it.
My suggestion with grammar here is if you've come from the IELTS test, this is a very different test. And the way that you write in IELTS is very different to the way that you write in OET. In the IELTS test, you need to, in fact, it's part of the criteria that you need to have a wide range of grammar in your letter. Like you almost need to insert some conditionals and insert this type of sentence type, etc., and make them compound, complex. And it's very different in OET. OET is all about clarity. It's about conciseness and clarity, and it just needs to make immediate sense to the reader. So little things, little grammatical things, you know what? I wouldn't, sure, nice if you can fix it up and clean it up and get it all 100% perfect. But if it's not 100% perfect, it's not that big of an issue. I wouldn't stress the little things.
Can I just answer one question here for Adaremi?
Yeah.
Who's asked this a few times, and I think you've popped it up a few times. Do we need to put the patient's address in our letter or not? I get asked this pretty much on a weekly basis. The answer is no, you do not. If the case notes provide the patient's address, you don't need to put that in there. Okay, the only address that you need is the actual recipient's address, and that's it. And that comes directly from the writing task. Now, whether you put that patient's address or not, the assessor does not mind. So if you put it in or if you leave it out, you're not going to lose any points, you're not going to gain any points. So just don't worry so much about that one.
Cool. Okay, I've got a few questions here. Soaliha and Jatin have both asked about word count. Can you talk about word count?
Yeah, look, word count, again, that is a question that comes up every single time we talk about writing. Look, the big thing to take away from this is that it's an approximate word count. Okay, so approximately between 180 to 200 words. Now, if you get to 175 words and that's it, no problem at all. If you get to 210 words, no problem at all. Just make sure that what you've actually included is relevant and you haven't included anything irrelevant. It's a bit of a misconception. The assessors do not count your words, so you don't have to worry about that. It is complete rubbish. They never count words. All they're looking for is an estimate. So they can see your letter, they know roughly how long it is. If it's excessively long, if you've written for 2 pages, what that assessor will do is actually look for information that isn't relevant to that reader. So if you have included that type of information, then you'll be marked down. But if what you've included is all relevant to the reader, you will not lose any points whatsoever.
Cool.
I hope that answers that one.
All right. So, okay. A question from before up in the chat was Sadia asking about, in the letter, do we need to include our own personal medical knowledge? Like if I see something in the case notes and I think, you know what, I think this might actually be this disease, but it's not written anywhere in the case notes. Is that a good idea?
No, I would stick to the case notes as much as humanly possible.
Yeah.
And again, look, remember, you're not tested medically. The people marking this letter are not medical experts. What they go by is what is actually in those case notes. And so if you start going off on your own medical knowledge, all you're really doing is confusing the assessor, because the assessor's only going on by what those case notes say themselves. So don't try to, your job is not to diagnose the patient or anything like that. Your job is to basically take those case notes and use those in your letter to that recipient, the relevant case notes. Okay, so at no time you're tested medically, so I would advise against it. Definitely.
Great. Here's an interesting question from Jaskarat, which is, should we use words like regrettably or unfortunately or fortunately, for example?
Look, I would advise not to. OET now advise not to as well. There is a lot of regrettably and unfortunately being used, and what that does is it's basically using your own emotions. It may not be regrettable, but it's also just wasted language. There's no need to write the word regrettably or unfortunately or anything else. So instead of using your own emotion, your own judgment, I would advise definitely not. No, leave it out.
Great. Okay. A few questions have popped up about medications. One question from Abdul is about, do we have to put the values, like the milligrams and stuff in of the medication? Let's start with that one, and then I have another
Yeah,
one.
sure. No, that's a good question, Abdul. Look, people do worry a lot about the medications and medication lists and things like that. Look, my advice to you in that situation with the dosages, if the person that you're writing to needs to know that specific dosage, say for example they're the ones giving the medication, then for sure put it in, definitely. A lot of people might just bracket that information, but you certainly don't need to include dosages to someone if it's just about the medication that that patient takes. So if that patient's taking that medication on their own, they're not needing any assistance for that medication, there's no need to include it at all. I think the next question you're about to ask there, Jay, was about the lists.
Yes, correct.
Yeah, look, again, if the medication list is quite long, say for example they're listing 9 or 10 medications, you are perfectly within your right saying that the medication list is attached to this letter. No problem at all. What I personally do is generally I would mention maybe 1 or 2 of those medications, the most important medications, and then say, a full detailed medication list is attached to this letter. You can do that. But to be honest, it's quite rare that OET do that these days.
Yeah.
Typically speaking, they will only mention the medications that are actually relevant. So it's the one that is actually connected to the current issue of that patient, the current medical problem, and they will show you that connection. So then it's up to you to connect that into your letter. Okay, but dosages only if that person actually needs to give that medication for the patient.
Yeah, it's making me think, Brad, that perhaps whoever's asked that question about the lists of medication might be dealing with some badly written case notes.
And that's usually the way. That is usually the way. Look, I've seen case notes out there that have 13 or 14 medications. You're not going to see that in an official test. Okay, OET. They design these case notes in order to get you to express yourself in words. You can't do that if all you're doing is listing medications. And at no time in this test are you actually meant to list. Your job is to put that into grammatical sentences, okay? Not listing. You don't want to list anything. I hope that answers the question.
Tien's got another question, which is, if you're writing to a specialist, how do you sort of formulate your language if you have a recommendation, but you're writing to a specialist? So how do you, it's a great question because it's sort of...
This is another, it's something that's coming up a lot these days. Look, you don't want to sound condescending or patronizing to the specialist that you're writing to. Generally speaking, you're not actually recommending something when you're writing to a specialist. You're really finding out if you need to know something from that specialist. So it's the specialist who needs to actually conduct the investigations or do the procedure. So you're not actually generally asking that or telling that specialist what to do or how to do something. You're just giving the details of the patient's current situation and you're providing that to the specialist, and then the specialist will take it upon themselves to do it. Now, you will see some case notes that say, for example, you're asking a specialist to do a certain thing like a colonoscopy or an endoscopy or something like that. You can say that in a sentence. You can say that the patient requires a colonoscopy. Now, obviously, a real specialist would know that, but this is only make-believe. We're not actually writing to a real specialist. What we're doing is taking the case notes and providing that information to the specialist in the OET, okay? So remember, you're not tested medically. You're not going to offend the make-believe specialist or anything like that. But no, you're not actually telling them what to do. What you're doing is just referring that patient with that patient's situation and asking for that relevant treatment or procedures. I hope that answers that question.
Great. Abdul's got a good question, which is related to medical terminology. And Abdul's asked something like, should I use words like gallstones and pain, or should I change it to biliary colic, for example?
Yeah, and leukocytes and all that. Yeah, I can see that one now. Look, there's no need to change the terminology at all. If you're...
Brad, what about if in the case notes it's using a medical term and then you're writing to somebody like a physio who may not understand that? Is there some sort of translation, like to simplify it for the physio?
Well, the actual translation in that case will be on the case notes. And so what they will do is put in the full medical term, and then in brackets, they'll actually have the layman term for that.
Yeah.
So then it's up to you which one you want to choose. If you suspect that the reader doesn't actually know what that medical terminology is, I would use the one in brackets. But remember, doctors and nurses, you're only writing to medical professionals now. You're not writing advice letters to parents or anything like that anymore.
Okay.
Some professions do, but in that case, it will always be given to you in the case notes. It's not expected of you to actually know that medical terminology, so there's no need to change it at all. If you do change it just because that is, it's just a reflex type of a thing that you're used to doing as a doctor, for example, you won't be marked down for it or anything like that. So don't worry about that.
Okay, fantastic. Arun's got a great question. So the purpose of the letter has to be in that first paragraph. It needs to be immediately clear what the purpose of your letter is. Arun said, well, okay, so in that purpose, we should mention the request, like what we want that recipient to do. Is it okay then to mention it again at the bottom of the letter in the request paragraph as well? Basically, are we mentioning that request twice? Is that okay?
Yeah, look, I mean, it's kind of inevitable in some of them. You will actually mention it twice, but generally speaking, you'd mention it in a different sort of a way. So what you might mention is just what that say, for example, further investigation. You might use the word further investigation up in the actual purpose, but then down at the bottom, you'll actually explain what that further investigation involves. So you're just sort of expanding it out as you go. So you're not actually just using the same words exactly up the top and down the bottom. What you're doing is just giving a very, very broad mention of it in that purpose, and then you're expanding that later on down in the request paragraph.
Yeah, great. So it's briefly mentioned and then elaborated on further down the letter. Cool. And before when I said about the use of templates, there is a basic structure to a letter, isn't there? Like that, there's always an introductory purpose paragraph, which will briefly mention the main medical issue and the request. And then there's also a request paragraph at the end. They're basically, it's almost safe to say that they're always there. Whatever comes between those two paragraphs, though, is depends on the task and the case notes and on test day. Do you think that's fair?
Yeah, no, that's definitely perfect. Yeah,
cool.
You're always going to be writing that same sort of fashion, but that bulk of the actual body in the middle of that section, that's up to you guys. That depends on the reader, depends on the situation, it depends on the task itself.
Great. All right, cool. We're going to now move on to reading and listening together. So if we've missed your questions there about writing, my apologies. By the way, if you are preparing for OET, you probably, if you're taking it on Sunday, you might have left it a bit late to sign up to E2 language. But if you're taking the test in a month's time or 2 months' time, then all of the information that I know, all of the information that Brad knows, all of the information that Judy and Eunice and Marie-Claire, all of these expert teachers is on the platform. All of it's there. All of your questions will be answered. There's live classes twice a day, 5 days a week. That you can take tutorials. You can get writing feedback. You take speaking mock tests. We've got the mini mock test. We've got 5 full practice tests and methods lessons. Anyway, if you need to prepare, do think about signing up to, even if you just get the express package, which is valid for 3 months. It's it can save you a lot of time, a lot of stress, and it will very much improve your chances of success.
Yeah, I'd like
Okay.
to add to that. Seriously, most of these questions, we actually answer this on a daily basis in those live classes. So don't leave it right until the end, guys. I mean, if you're doing your test tomorrow, I know it's a bit daunting and you've got all these questions coming up, but you'll feel far better and you'll feel a lot more confident if you can answer these questions a week before and practice it a little bit rather than the day before. So yeah, join us for the live classes. Seriously, we go through all of this sort of stuff every single day for you. Sorry,
Yeah.
Jake, go for it.
No, I agree. The live classes are fantastic. Okay, OET reading and listening. I'm just going to assume that you guys all know what's going on with this test. If you don't, again, it's all the overview lessons on E2 language will help you to understand what this test is about. So please pop your questions in regarding reading and listening. I think typically this is a bit more straightforward. People don't really have that many questions about this. I think the trickiest subtest here is probably reading part A. Reading part B is multiple choice, very straightforward, and reading part C is also multiple choice, very straightforward. Reading part A, just briefly, this is how it works. You get 4 texts, different styles of text, like one might be a little paragraph, one will be a graph, one will be sort of dot point information, for example, all about a common topic, let's say migraines, for example. And then you get a series of questions, some short answers, some gap fill, and some matching questions. You only have 15 minutes to complete 20 questions, so that's less than a question per minute. It's really a test of your ability to speed read and to scan read for information very quickly. That one certainly requires practice because you've got to sort of get used to that style of the test. I would recommend that for sure. Okay. Here's a great one. Joseph, how can we get the answers for listening part B and C? It's like, yeah. I might have a go at a bit sort of broader question here, Brad, which is how can I improve my listening skills? And I've been thinking about this one because listening is a challenging task at the best of times. Of course, you've got vocabulary, which is really the key, having a broad vocabulary. And again, having that sort of immediacy of knowing the meaning of the words as soon as you hear them. So there's not that process of going, oh, that word, what does that mean again? And by that stage, your 5 seconds of lecture has gone past. So vocabulary is key, but also what you need to be aware of is how spoken English differs from written English, because if you spent most of your time learning English by reading and not listening to real, authentic spoken text, there's quite a substantial difference between the written word and the spoken word. You see, the spoken word combines different elements like contractions, where we join words together, connected speech, where, again, words really join together and just sound like one big word, intonation patterns, ups and downs, pausing, what else is there? Word stress. So in order to improve your listening skills, it pays to be aware of how spoken English works. Yeah.
I'll just add to that too, specifically for the test. You've got to remember too, part A is very, very different from part B and C. Especially part C, where it's focused a lot on opinion. And that's a really good way to actually go through that, is to break down on the transcript itself and look for the vocabulary that's actually expressing opinion, which is something that we do in the live classes. So if you are familiar with the live classes, we often will actually point out in the transcript the vocabulary and the phrases surrounding the opinion. For part A, though, remember, it's all because of the fact that it is all patient focused. It's a very different way of listening. It's a very it's a different way for that person to be speaking. So in part C, it's quite formal, quite academic in a way. Part A, it's kind of chit chat because it's a consultation, and because of the fact that you're listening to that from the patient's perspective, you need to be familiar with that type of language. So you need, if you are practicing from various pieces of audio, try to link it up to OET. So part A, try to focus very much on consultations, like a program like RPA, something like that, where they're very heavily focused on consultations. If you're focusing on listening part C, make sure that you're listening to something with opinion and a bit of debate in it. So a couple of opinions maybe in that one piece of audio. So it's really important to try to practice as close to the OET as you possibly can.
Yeah, good call. Okay, a few people, Joseph included, but also Adaremi have asked about, how to get the correct answer in listening part B and C. And these are hard because what you're doing is you're doing multiple skills simultaneously, because yes, it's a listening test and you're listening carefully, but then you have this text in front of you that you have to read at the same time. And the human brain really struggles, or I actually think it's impossible to read and listen simultaneously. So you can't be looking at this and reading this carefully while listening to a lecture and listening carefully at the same time. So it's sort of this weird process of flicking between the multiple choice question and listening, and then flicking down and listen. I think, unfortunately, in listening part C, that's how you do it. You sort of do this flickering technique. In listening part B, it's actually possible, and I think this is the best technique, is you read that question prompt. It'll say something like, actually, can you give me an example listening part?
I'm just trying to think of the same.
Just something like, what does the nurse think about this? Whatever.
What do they agree about? Something like that.
Right. What do the nurses agree about? Okay. And so my suggestion then is to not actually be reading those answer options at all. You're just listening, thinking, okay, what are they agreeing about? What are they agreeing about? And you listen very carefully to that little conversation. You hear what they are agreeing about. And then you get a little bit of time, not much, like 5 seconds, to look at the answer options, very rapidly read them and go, okay, it's B. Because I find when I do listening multiple choice, I actually think it's the hardest task, because again, you're battling with that cognition issues.
And can I just say too, for listening part B, please listen to the entire thing before you try to answer that question.
Nice.
It's very quick. Okay, they're like 45 seconds long or something, very dense in information. Please listen to the whole thing. Don't just jump in and try to answer it, because it often changes at the end. Okay, so wait for the whole thing.
Do you want to talk about this distractor idea that is in language tests?
Yeah, look, I mean, distractors are actually deliberately put into all of these language tests. So this is what makes multiple choice so difficult, because of the fact that every single option will be mentioned at some stage, or at least will be vaguely mentioned in some respect. So you've got to be, as Jay was just saying before, you've got to really focus on that question itself, because the options, if you're focusing on all three options, the A, B, and C, you're going to confuse yourself because you're going to hear all of it. So you really need to be focused directly on that question. Realize that there are distractors, and try not to sound stupid, but try not to be distracted by that and try to focus purely on the question. So we used the example before about what do the nurses agree about. They might mention a couple of other options about their individual point of view, but they're actually not focusing on their agreement. So what you're doing is just thinking agree the whole time through, and then one of those options should hopefully stand out to you.
Yes, yeah. See, how people go wrong is they do this thing called word spotting. So, for example, let's say the question prompt says, "What does the nurse think about Mr. Smith's wound?" Whatever, and then the nurse will say, "Oh, apparently Mr. Smith's wound is not healing." Blah 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 blah, and someone will go, "All right, got it." Bang, it's A. And then 10 seconds later, she'll say, "But as far as I'm concerned," and then so that's the actual answer. So there's this thing where people immediately jump on the first thing that somebody says. It may be the first thing that the nurse says, but make sure you listen to the entire passage before you go, aha, no, it was actually B, not A, for example. A lot of people are expressing grievances with listening part C, and I completely agree with you. It's a tough, listening part C is tough, isn't it?
I think that's actually, to me, it's one of the hardest parts of the test. Listening part C, look, even for a native English speaker, it's a tough part of the test.
Yeah.
Luckily, you only have 3 options. Reading part C, you've obviously got 4 options there. You've got A, B, C, or D. So they've taken one of those options out just to make it a bit easier. But yeah, look, as you were saying before, Jay, I mean, reading and listening at the same time. Look, that 90 seconds in the beginning of that listening test is absolutely vital. You need to absorb the information before the actual audio starts. I would advise try not to get caught up too much in the options themselves, because you will end up doing word spotting, as Jay was saying before. But really focus on the question itself. So you're getting 90 seconds to look through 6 questions per extract. And I think that is, I mean, a minute and a half, that is ample time to do that, but really absorb what the question itself is asking you.
Yeah. One of the things that we do well on E2 Language to help with listening part C is you can do the practice test under test conditions where you just hear the audio and see the answer options, but we also show you the transcript. So if you do get stuck or you just want to start with the transcript, you can actually listen and read through the whole thing to start with and pause, and and it helps you to understand how the questions are constructed. I think that's really helpful. Sort of knowing the spacing and how to move along the questions following the audio. So there's the way that we've done that in E2 Language is very helpful. Okay, good. Not many questions here. One from Kjor Winton about reading part A. So Kjor's strategy here, which I agree with, is to, at the beginning of reading part A, it's the one where you only have 15 minutes, is to spend a minute reading through the texts, the 4 texts. So spend 15 seconds on each text, looking at headings, subheadings, keywords, getting an idea of what it's about, and then going to the next one, headings, subheadings, because the text will differ. This text might be a definition, this text might be a Q&A, this text might be a case study, and this text will be some data or statistics or something. So then you've got a basic idea of, okay, it's about migraines, but all of them are different. And then you move into the first matching questions, which asks, in which text will you find information about blah? So Kjor's question is, Kjor wants to spend more time on that. But I think when you start to do the matching questions, those first set of questions, you develop more of an understanding of each text. So I think that's probably fine. And then you move into the gap fill ones.
I'd just like to, that's exactly what you just said. Make sure you do the matching questions first, please.
Yep.
Don't go to the end of the test and do sentence completion first. If you do, you're just not going to have that full understanding of the text. Those matching questions are put there in the beginning for you to actually, just so you can go through and familiarize yourself with those texts. So it's really, really an important part of the test. So always do those first 7 questions first.
Yeah, there's some silly ideas on YouTube and stuff about starting from the bottom of the questions and moving backwards. It's ridiculous. Start with number 1, 2, 3, 4. Go through the sequence properly. Here's a really good question from Adaremi. Do you have an idea if the OET examiners take the test under exam conditions so they can understand that in real life the exam is difficult? I think that's why I've taken the IELTS 6 times, for example, and I've taken the PTE once, I've taken TOEFL once. I haven't taken OET, but I think one of the reasons why people like E2 Language is because we have empathy for how challenging these tests are. And we hear you, Adaremi. We know how difficult they are. But have the OET examiners done it? Yes, I think they in their sessions when they create these tests, they would definitely sit down and do them under time conditions. There's a lot of testing of the tests that takes place before they make them go live. So they're extremely well constructed tests. They're not poorly made at all. Very, very clever. Yeah. Okay, I think that's about it, Brad. Have I got any other slides here? Oh yes, I've just got the websites there. So if you need help, go to e2language.com for OET preparation. And if you need sort of more help, like you need to build your vocabulary or improve your pronunciation or improve your grammar, or even just do some sort of basic general English courses, check out e2school.com. You can do both at the same time. You can prepare for your OET and build your grammar and pronunciation at the same time, for example. But E2 Language is for test prep, E2 Schools for sort of skill building. They all come with live classes. but E2 Language is the one for OET that you should check out. It's a great website. Cool. I think that's all. If we didn't get your question, you can send an email to hello@e2language.com and one of our student support officers will help you out. But cool.
Cool. And I'll be doing the writing for medicine in about an hour's time. So anyone who's joining me for that, if you have any other questions that we've missed tonight, you can always ask me during that, because I'll leave a bit of time at the end, and I'll go through a little mini Q&A with you at the end about that too.
Brilliant. Okay. Good stuff.
Good.
All right. Thanks, Brad. Thanks, everybody.
Thank you very much. Thanks, guys.
See you guys.
See you soon.